Deputy Minister Dr. Sibongiseni Dlomo and Prince Nhlanganiso Zulu, the son of the late King Goodwill Zwelitini, will be in Vosloorus today for a double protection event for men with a focus on COVID-19 vaccination as well as medical male circumcision. Prince Nhlanganiso Zulu is a TB ambassador, and the event is aimed at promoting men's health. Our reporter Tseho Moahi is in Vosloorus. Tseho, good morning. What's happening where you are?
Well, good morning, Nhlanhla. So indeed, the event was expected to start at 9 o'clock this morning. However, we are still waiting for the Deputy Minister of Health and for the Prince to make their way here at this particular event here in Vosloorus. It is right by the Nguni Hostel in Vosloorus, and I mean the significance of that, of course, is around the issue of promoting men's health. But to give us more details about what they are doing here, I'm joined by Lesego Tibile. She is from Isibani Development Group. Lesego, thank you so much for your time. Let's start off with, what does Isibani do and what are you guys doing here today?
Okay, thank you. Well, Isibani is an NGO, Isibani Development and Partners. We deal mainly with TB patients and TB. So what we do is we collect sputum and we do TB testing. That is what we'll be doing here today. But we have other services that we provide. We provide support to the surrounding facilities, which are the clinics, and we do TB tracing for them. If there's any patients that have just been tested positive, we go out, we look for them. If there's any patients that are defaulting on their medication for TB, we go out physically and we look for them. We have monitors also. There's different types of TB. There's DS-TB, there's MDR-TB. So MDR is more of a resistant TB. So we have monitors also where DRTBs have a little box and they open that box every day and it clicks to us at the facility that the patient has taken their medication today. We also have a food program. We support TB patients with food because the TB medication is very hard on the body. So they need something to eat, you know, and most of the patients have no jobs. And that's why TB is a pandemic in the country. South Africa, if I'm not mistaken, I'm not sure if we are the third highest with TB in the world. So that's what we're trying to do. We're trying to eradicate and lower the statistics of TB.
Now, as you mentioned, of course, it is the highest in the world, third highest in the world, which of course is a problem. And are you guys seeing more and more people that are reluctant to take their TB medication?
Yes, we are seeing people that are more reluctant to take their TB medication because TB symptoms are the same as COVID symptoms. So a person will think they probably have COVID or pneumonia. So when you come to them and you ask for sputum or you ask them to get an x-ray, because that's another way of testing for TB is by x-ray, they are very reluctant. They're saying, I don't have TB. How do you know I have TB? You come here, all along I've been sick, and then you come here and you tell me I have TB, and that's a lie. So we need to educate our fellow South Africans on TB. They need to understand that TB is a curable disease. It is curable. You take your treatment for 6 months. If it's MDR, you take it for 9 months or a year and it's cured. But we need to protect ourselves. We need to wear our masks. We need to social distance. And we need to test for TB, guys. TB is an airborne disease. Anyone can get it. If you're living with somebody at home with TB, there are high chances that you can get it. People who are on ARV treatment, people who are diabetic, people who have high blood pressure, any immune-compromised person is at a very high risk of getting TB. So that is why it's very important when you see us in the community, please allow us to come and talk to you, educate you, and please give us sputum. We collect sputum, we go door to door. We are in Gauteng, we are in Tembisa, we are in Johannesburg, we're here in the south, we are in Itwatwa. So we are community health workers going in door to door, collecting sputum and helping TB patients get to the facilities.
Lesego, just briefly for me, so today it is about the men, looking after the men and promoting their health. How are the men reacting to TB treatment and to TB testing?
The men are not, they are very reluctant. They're like, don't call us, even if you take the sputum. we'll like, please give us your speed time, you know. They'll be like, no, 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 no. And then we'll be like, okay, like, we'll try to talk to them. They'll agree, and then they'll be like, but don't tell me that I have TB. Don't call me and tell me I have TB. In other places like hostels, there are a lot of men, and we struggle to enter. That is why we took this opportunity today to be able to test the people in hostels. Because in hostels, they live like in a room, and there are many of them. So that also increases the chances of having TB. Men are smokers, men work at the mines, you know, so those are the things that contribute with TB. Men work with the sprays in the cars, you know, with the building. So all the sand and all those fumes, do affect the lungs. So what I want to clarify is that everybody has TB in their lungs. It's just that it's not active. So something happens that activates the TB. That's when you need to start taking your medication. So can all TB patients take their medication and finish? We are here to support them. We are here for them. We are community health workers. That's what we are here to do. Can they please take their treatments? Can they finish? And can they stop exposing others to it? That's the most important thing. We're trying to stop the exposing of others, because I don't think everybody understands that TB is an airborne disease. Anyone can get it. We even have children that are 6 months. Nobody in the household has TB, but you will find that the child has TB because maybe they were in a taxi where somebody had TB and they coughed, the windows are closed. You see those situations. That's what spreads TB.
Thank you so much.
Thank you.
This is TV. They're just giving us details about the Isibani development project and what they do and what they'll be doing here. Of course, the issue being around the issue of men health promotion rather, and really just ensuring that men are, you know, more optimistic to get tested for certain things, including TB. There's also a big van here around the issue of male circumcision. So they're also going to be promoting that as well at this event. Nhlanhla?
Thanks a lot. That's our reporter, Tsekwacho Moagi, who's out in Vosloorus for a very important cause, calling on men to get themselves checked out.